Hello, everyone. Thank you so much for joining us for our July quarterly state advocacy webinar. My name is Syed. I'll be your host for today. If you would like to ask a question, feel free to type it in the question and answer box, and a member of the RDLA team will direct them to the speakers. If you are a member of media, we ask you to formally announce your participation, and we will encourage follow-ups with media and panelists afterwards. Give me a second. And let me make sure that the chat can. All right, everyone should be able to use the chat function now. And you should be able to see your messages pop up. So feel free to drop questions inside the chat. If time allows after the panel, we'll have a question and answer at the end. Okay, so our speakers for today, we have a panel on building coalitions. We will kick it off with Stephanie Lapido, who is the executive director of the Hemophilia Association of New Jersey. Then we'll pass it over to Kimberly Hochstad, the founder and president of the Wisconsin Rare Disease Alliance. And then we will pass it over to Carolina, who is the founder and CEO of Born a Hero, and the Northwest Rare Disease Coalition. And then next, it'll be me. My name is Syed Ijaz. I'm the state advocacy manager for the Every Life Foundation for Rare Diseases, and I'm part of the RDLA program. The agenda for today I just covered it. We're going to start off with building rare disease coalition at the state and regional level with our three guest speakers. And then I'll discuss a bit more about how Rare Disease Legislative Advocates works with state and regional rare disease coalitions. But for now, I will pass it over to Stephanie to introduce us to the Hemophilia Association of New Jersey, and talk a bit more about building coalitions in the state. Stephanie?
Thank you, Syed. I really appreciate this opportunity today to be with you all. Again, my name is Stephanie Lapido. I'm executive director of the Hemophilia Association of New Jersey. We are a nonprofit 501c3 organization that represents the entire bleeding disorder community in New Jersey. Our mission is to educate, advocate for, and provide assistance to anyone in their family that is affected by hemophilia or related bleeding disorders. A little bit about our recent legislative efforts. We had seen an uptick a couple of years ago in what's called a copay accumulator adjuster program. We were very lucky in New Jersey that other states had been hit with this before we did, so we were prepared for it. But once we saw some of our members being affected by it, we hit the ground running legislatively. So what is a copay accumulator, and how are building a coalition to get your legislation across the finish line important? A copay accumulator is when an insurance company takes any sort of manufacturer assistance or any assistance from a third party to help you pay for your out-of-pocket costs with your insurance. And they take it as a payment, then they readjust your policy back to zero, and then charge the respective member of the policy, the patient essentially, for whatever is responsible. Now, that could be anywhere from $10,000 to $12,000. We've seen as high as $15,000 with some of our members. And oftentimes they don't know that it's a part of their policy. And so when they get hit with these large out-of-pocket costs that they think that they have assistance for, it's shocking to them. And so that's where we come in as an association, and we make sure that our members never have to worry about putting food on their table or paying for their medication to take care of themselves, essentially. And so we were able to hit the ground running when it came to legislation in New Jersey. And building a coalition was the first step for us. And so how did we do that? Lucky for us, again, we in New Jersey saw this later than other states, and there was already a national coalition that had already been built. So the first thing that we did was tapped into that resource. we made our connections with them. We took best practices from them, and we were able to take it back to our state lobbying firm in terms of language for the legislation and things of that nature. They've helped guide us through the legislative process. Anything that maybe other states have seen in terms of what opposition would say and how to speak clearly to make sure that we clarify any sort of opposition in that way when testifying at certain committee members. In addition to the national level coalitions, we also did very grassroots efforts where we looked into networking events in our state capital. We attended them. We met with folks, explained what the issue is, and came about that there were many other disease states that were seeing their members having the same issue that we were. And so we were able to build those contacts from there. So my best recommendation when it comes to coalition building is not just tap into the big national resources, but also get in and be gritty with the grassroots efforts as well. We were able to take both of those efforts. And once our legislation became official and we had actual bill numbers, we were able to send letters that came directly from the coalition that we built in New Jersey to the members of whether it be the respective committees on the Assembly or the Senate side, and show them that it may be coming in terms of us as the leader of the from the hemophilia community, but we had other communities throughout the state of New Jersey that represented many people across the state and many different districts across the state that were affected by this legislation. Um, and so I would say making sure in terms of coalition building, it takes a long time. I wouldn't expect anything to happen overnight. I would make sure that um, kind of understand that part of it. And you really have to keep, it's almost like networking 101 is what I've kind of referred to coalition building. You put yourself out there, you put your issues out there, and just keep grinding with that process. Another thing that we found very helpful was coming up with a one-page document that was very concise. It was almost a document that was our elevator speech that people could take with them, whether it be at a networking event or speaking with other organizations and introducing this topic to them, or even at the higher level and speaking with the legislators, the change makers in our state. That letter was able to outline exactly what the issue is and explain what it means, how it's affecting people. And if you have data and personal examples, that's terrific too. But keeping it to one page, we found that that was very important also, because then we were able to give that to folks. It wasn't too wordy or anything like that. And again, across the one pager, we had everyone's logo within the coalition that joined on with us. Um, and so I would say those are really the success stories that we've had. Our legislation was introduced at the very end of October of 2024 and moved very quickly through the Assembly and the Senate. If it wasn't for the break in New Jersey's legislature, we probably would have had a bill that was at the governor's desk, but unfortunately, we had to put a pause to it because they went on a bit of a recess. And so we're going to be picking up with that in the fall and hopefully have a bill that becomes a law officially. And I really, really think that we were able to move this along as quickly as we did because of the coalition, because of the voices that collaborated and came together. And those efforts that we all did as a coalition and as a group really took this across the finish line. So Syed, I think that's all that I have in terms of coalition building. I wanted to keep it, on time for you guys, but I see that there might be some questions in the chat, but I'm also happy to answer any other questions that may come along.
Sure thing. I think we'll save the chat questions towards the end and then we'll run through. Right now, I'll shift over to Kimberly. Thank you so much for your presentation, Stephanie. Stick around for the Q&A at the end. But yes, over to you, Kimberly, and feel free to share your screen if you need to present your slides.
That's good. All right. It was a late add to this group, so I do have some slides to help guide me through, and I'm really glad to see everybody or hear everyone, see everyone on the call today. Really excited to be a part of this. Can you see my slide?
Yes.
Yes, perfect. I don't see it on mine, which is weird. So, okay. So anyway, yeah, so I want to talk a little bit today about the Wisconsin Rare Disease Alliance. And I wanted to share just a little bit of some of our founding pieces. One of our key topics that we are working on legislatively is the same as Stephanie. We are working on copays. So I won't go through, all of that. We're also working on newborn screening bill, but want to talk a little bit about just organizing and building our organization. We are a new baby organization, I will say. We actually launched the alliance in 2023 in like November. And so we did a soft launch and hard launch last year in January, and have built a board. We've got committees, we've got a website, we've got an active social, our mailing list. Actually, am pretty excited about this. I got a note yesterday from our team that we're at about 800 people on our mailing list. So we have been working it. Now, about 100 of those are legislators. So if you take but they count, we'll keep them on the list. But we've been working it really, 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 really hard. We also have spent a lot of time over the last year just working on it's outreach. It's outreach across patients, it's caregivers, it is friends of Rare, it is certainly our medical community, medical folks, researchers, whatnot. We've been really trying to pull everyone together and look at this coalition as all stakeholders coming together and collecting that information. So things that we have been working on in general, where we focus, we are working, and I mentioned earlier the newborn screening bill. We do have a bill here in Wisconsin that's continuing to move forward. It is a RUSP alignment bill tied, so it's a little, let's call it quirky right now, but we're going to continue to work on that process. We also have a copay bill that has some traction. We have melded the language into a PBM bill and have been partnering really, really tightly with the Pharmacist Association here in the state of Wisconsin in working through that that organization. There also is a Wisconsin copay coalition, and we've been really, really involved in that process since we started. Well, we've also, had multiple opportunities to testify at the legislature and really get engaged. There is a biomarker bill that is kind of in the works right now. It hasn't launched yet. And then we continue to talk about genetic testing at the Medicaid level, and are working on a baby badger program as well, which I'll talk about in a minute, and other things. What I wanted to also mention when it comes to federal activity, so we're really focused in Wisconsin on state-based activity because we recognize there isn't a rare disease, we are the coalition in the state to be able to do that kind of work. There isn't anyone else really focusing and pulling us all together as a rare community. From a federal standpoint, we really do lean on Every Life and other organizations like NORD and whatnot that are doing federal work and tend to sign on from that perspective, but really keep our focus very strategically focused on the state of Wisconsin. So kind of what we're doing. Collaborations is why you asked us to be on today and to talk about. And so I wanted to chat about some of the things that we are working on in the state. And just in this last year, we've had such an amazing opportunity to just reach out. And it has been, I would say the word overwhelming in how positively individuals and organizations and societies and whatnot have welcomed us. So it's been really awesome. There is a baby badger program that's genetic testing folks related. I think a lot of us have heard about the baby projects around the country. There's a baby bear in California, a baby manatee in Florida, and so on. There is a baby badger here in Wisconsin. We're really excited about that. And we've had an opportunity to work really closely with that group to actually help them ensure that patients and caregivers are involved in the process of building out that project. And so we see that as a huge win from a coalition standpoint, where we have worked with the Baby Badger program, and they're actually bringing in patients, caregivers, in the process of building it out. They also are paying those caregivers for their time, which I think is really, really important and respectful. We've also been building collaborations within the newborn screening lab. We talk regularly. In fact, I had a call this morning with the lab, and we're talking about multiple different opportunities to support. There are a lot of things that we want to do with the lab here in Wisconsin. We have an amazing newborn screening lab in Wisconsin. We are actually partnering with them at the end of the month and this next month to do a tour. We're bringing in some key legislators and touring them through the lab so they understand how important that work is. I also really want to mention, we don't talk about this, I think nationally a lot, but at the state level, how important it is to be connected with the other coalitions and societies and other groups in your state. And so, I mentioned the Copay Coalition here in Wisconsin. We work very closely with them on regular things. There is a medical society in Wisconsin, a hospital society. There's a pharmacists association. We're working, and we have regular calls and conversations with those groups. And we find that that is really, really helpful. They all have lobbyists, and so there's learning that we can share and learn through those processes. We also have found a way to work with them to reach our medical communities and really pull them into this stakeholder community that we're building within rare disease. And the response has been pretty amazing. We have a lot of folks in the medical world that are on our mailing list and that are actively dialing in. I'll talk about our advocacy day that's coming up soon, and we actually have quite a few folks coming from the medical society or medical side that are coming to our advocacy day. So we're pretty excited about that. Other collaborations, I just got a list here. We are working with the bio group here in Wisconsin. We're also connecting with industry regularly. We all do that regularly, and we learn a lot and partner really, really nicely with all of those groups. We also are really connected with the research facilities or research colleges here in the state. The UW and the Medical College of Wisconsin are two of our best in the state, and I think are two of the best in the country, because I think they're amazing, and I would advocate for that. So we work regularly with them on lots of different things. Legislators, obviously, we partner there. The governor's office, we're building. We literally in the last year and a half have been able to build relationships with everyone on this list, and so it has been a lot of work. It takes a lot of time, and it is completely and utterly worth it. So from that collaboration standpoint, I can't say enough about how important it is to work together. And as Stephanie mentioned, working with the other coalitions and the other disease groups in the state, we can't function, as a standalone. We'll never be funded long, enough to be able to do all of that work. But it also is just, it makes a difference, and everybody can connect. We talk a lot about 1 in 10 people have a rare disease. In Wisconsin, we've got about 6 million people, and so we must have about 600,000 people in the state. When I talk about our mailing list being 800 and being really excited, I actually feel kind of bad about that list as well, because it is way, way, way tiny where it should be in terms of reaching 600,000 people. So we have a lot to do. We do have an advocacy day coming up, September 11th. This is our first one, and we're really excited about it. I'm actually a little bit, let's say, freaked out about the fact that we already have 41 people that have registered, and we still have over a month to to have more people join. And we hear from people every week, so we might have 75 people at this meeting, and we're super, super excited, and I think it'll be a great day. And people really are interested in Wisconsin and participating. We're really thankful for some of the support that we've gotten. Actually, Patient Rising, as another patient, collaborative organization, has reached out to support us with that day. And we've got a couple of lobbyists who have volunteered some time to help us set up meetings and whatnot. So we're really excited about what we've been able to do. Our ask, we do have 2 bills, the newborn screening bill and the copay bill, that will be on our ticket to talk about. We also really given all of the misinformation and everything else that's out in the world, we are going back to basics and talking about some basics of, here is what rare disease is, here's who it impacts, what does that look like? So that'll be generally, I think, where we'll focus. We'll see if anything else happens in the next 6 weeks before the meeting pulls it up. So that's that. I do want to talk about something else I'm doing or we're working on. So I'm going to go really quick. We also, so through this process, when we launched the Rare Disease Alliance here in Wisconsin, it was really clear to me that that other organizations doing similar kinds of things, and I don't like to make things up or start from scratch if something exists out there. So we spent a lot of time just reaching out and talking to other organizations like Carolinas in Washington State, and having conversations with these organizations around the state who are creating their own state coalitions. And through those conversations, I think it gave us a lot of opportunity to learn on what we should do when we launched. And I think it helped us move very quickly in our process. But it also became clear in those calls and those conversations that we all have needs and we can all share from each other. So we started the State Zebra Network. A couple of folks, actually Swapna Kakani in Alabama and I had a lot of conversations, and the two of us one day were like, why aren't we talking to everybody on a regular basis? Maybe we should. So we started the State Zebra Coalition. We recognize there is so much opportunity and threats in the states, and there is an opportunity for us to do something if we come together, and there's a real need for patient advocacy to happen. So the network or the coalition is intended to be this group of stakeholders, people who are interested in rare disease in individual state work. And so the alliance is made up of nonprofit members, which are the state coalitions. It's made up of stakeholders. Those could be medical societies. It could be anyone in the state that might be interested in rare disease, researchers, whatnot. And then we also include corporate from that perspective and the learning that we can share there, so we can all work together. As a network, this is primarily a coalition of coalitions. We meet about once a month, and we share what we know and we gain what we can from others. That's really the whole premise. So there's a lot of networking that happens. There's a lot of peer networking and mentoring that happens back and forth. We share a lot, whether those are bills or how-tos or, how do you build a relationship with the Medicaid director or, those kinds of conversations we're having regularly. We also talk a lot about strategy and how do we look forward. And one of the things that we've started having conversations about in recent calls is beyond legislative, what kinds of changes or support or protections need to happen at the agency or directive level. So maybe not all of our work is legislative. It might be processes related or whatnot, changing things behind the scenes that maybe won't be seen, but will be by the masses. We're not going to stand by the governor and see it signed, but changes that really can be important in our state for our families. So we're doing a lot of that conversation. I'm going really quick. I know that's it. I know I only had 10 minutes, so we can talk about this all day. If anyone is not, we have 10 members to our coalition right now, and we're really excited about that and welcome others to join. What we do want to do is make sure that it's really clear that this is a coalition of coalitions to come together, but this is not an exclusive thing. All the work that you connect with any other organization, including EveryLife, do it 100%, 1,000,000%. This is a little bit different activity that we're engaging in, but it is all for the same good, and we really appreciate everyone in the whole network coming together. So I do it in 10 minutes? I don't know.
Thank you so much for sharing, Kimberly. That was fantastic. Please stick around for some question and answer, and I do see some interest in what you covered in the chat, which is some exciting news. Let me go back to sharing my screen, and then we can continue. And at this point, I would like to pass it on to our next presenter, Carolina Summer, from Born a Hero and Northwest Rare Disease Alliance. Carolina?
Thank you so much, and I appreciate thank you. I appreciate you guys having me here today. It's an honor to be here. I say yes to everything, EveryLife. I feel like I'm like, yes, I'll do it. I'm a big fan. So thank you. And I apologize for the green and yellow screens, but it'll be a little bit of fun. So again, I am the CEO and founder of Born Here Research Foundation and the co-founder of the Northwest Rare Disease Coalition. I'm here because I'm a rare disease mom. So Born Here studies 15 rare diseases. And the coalition is all rare diseases, but we'll talk more about that. And so I'm here because of my daughter. And today I'm going to talk about basically 3 points. From the fair came our coalition, and then just partnerships. And I'm going to kind of come at it more of a perspective of like the how to do it, instead of not so much as about like what we've done, but more like how to go about it. So we started the fair. So I'm going to start with the fair as the first topic, how it came to be. So the fair started in 2017, and we partnered with Seattle Children's Research Institute. And I just wanted community. I was searching for that, and the president of Seattle Children's agreed with me, and so we sort of just made it happen. And with all these years, I just realized how much, I think that through community we can build better policy, and that it starts with community. And so we're currently actually doing this in other states. We're having this in Colorado coming up, and Oklahoma and Ohio. So really excited about the expansion of this. So what I've noticed in the different states is that there's a lot of great organizations and energy and groups in the different states, but there's a lot of siloing within the different groups. And then there's a lot that connects us. And so I think the fair kind of does that as an opportunity to sort of bring us all together to talk and to see how we can work together. And one of the things that I find valuable in things like the fair is that it standardizes messaging. So a lot of times, if you have all these silos and organizations and you're coming to a legislator, they're sort of like, so where's this coming from? And, they're not in agreement with some things or not saying some of the same language. So it sort of standardizes the messaging when we talk to our legislators. And the fair is also a place where we can empower everyone about policy, like the policies that are important in your state. Again, the messaging to standardize that, and the how. And the fair also creates opportunities for new speakers. So giving an opportunity to our families in our state to share their stories really, gives them public speaking and an opportunity to really, we really just focus on our patients and like empowering them and helping them do their magic and connect to the community. So that's also been really helpful. And then with the fair, we try to get different people to do different parts of the fair. So it really in itself is done collaboratively, like built collaborative. So different groups will take on different parts of the fair. So they will take on a certain panel, and so that's part of the empowerment that we try to do. And then the fair is a place where we unite all stakeholders, industry, payers, patients, researchers, like everybody. Like our panels are a combination of everyone at the table saying their part. And so it works nicely because you can get all the perspectives on a specific topic. And it's also, we work on, it's not so much about presentations for us as about more of like panels and conversations, and then what actionable items are going to come out of that. So it's more meant to be conversational, and like, we have the uncomfortable conversations, and we work really hard on figuring out how constructively we can move things forward, and so there's a lot of like that to talk of how we can be constructive and respectful and move things forward at the same time. And there's a lot of flexibility in our talks and with our speakers. And part of why it's special is we try to bring all the right people that we want to have this conversation with at the actual panels. So it gets done there. And we use the opportunity of the fair to do videos and surveys and make decisions, bring momentum to topics, educate. For the new, excuse me, I don't know what's wrong with my throat. When we do the new fairs, we really focus on sort of understanding the gaps and needs in the community. So I think that's really important before you think about what projects to do, where are the needs? And so I think that's what the first fair that we really try to do is just really understanding where each state is at. And so from our fair comes our next topic, the coalition. So from the fair really is how the coalition grew, and we became a 501c3 in 2022. And even that is a collaboration in leadership. It's Max, Joshua, and myself. Max is our policy person, Joshua is our industry guy, and I'm more like the advocacy person. And so it's nice to have the different perspectives and strengths. We have different strengths and we divide and conquer. And I will say 501c4 has been really nice as a coalition because it is unlimited lobbying, but there's no tax deduction. So what I would recommend is to have a C3 under the C4, which is kind of where Born a Hero kind of lies. I mean, you could have your own C3 under your C4, but we use my other organization as a C3, and that's important for like sponsorship and things because we get tax deduction. And then I just highly recommend, as you do a coalition, to, as you're starting to build your spreadsheets, we realize like, oh my gosh, like we got to be more organized, and it has to be something that we want to do and invest in from the beginning. And so we use a database called EveryAction. When we were reaching out to our legislators, it was just taking so long. So this just does a great job of organizing the different stakeholders, as we do outreach and things. And also, just as we just makes it easier for our advocates to, send messaging to our legislators. And so that was something we really wanted to invest in. And excuse me. And then I think another really important thing for the coalition is that one thing that I spend a lot of time in is I speak to advocates every week, and I have a notebook where I keep track of every single advocate that I speak to. And I usually do like 30-minute conversations with our advocates, and I spend a lot of time learning about them. So like, what is your story? What is your journey? Patient organization leaders, what are your strengths? Like really knowing your community. Like I take a lot of notes on all of that and ask a lot of questions. And I teach them about the different projects so they kind of know and are aware where they might want to get involved. And I will say it's not always immediate, like where you might collaborate. So I think that's really important. But the reason why this is so important is because, my battery's low. Why this is so important is because you find out that, like if you're talking to the university or to an, genetic counselor and they're needing a story, I know exactly how to tell everybody like, do you really want someone to talk on their diagnostic journey, or someone to talk about cost, or someone to talk about, like, I know exactly how to make a panel where you have different perspectives on different stories because I know who has a strong story and what. So it takes a lot of like just doing that. And the way that we make decisions in the coalition is a lot based on the needs that we've learned from the fair and talking with or sharing the stories of the patients. And so it ends up being this balance between like the needs and who's willing to lead in these efforts. So that's kind of what it boils down to. And I apologize if I'm going to be moving, but my computer is dying. Okay, so then as far as one way that excuse me. I just don't want it to die. Another thing that we do with our coalition is that we have task forces. So to complete different projects and different, if you're working on a specific topic, even on a bill, like we have a task force of a specific bill. And so we usually have 2 leaders that lead each task force. And we've been finding that to be very helpful because it kind of holds them accountable. They hold each other accountable for things. So that's been really effective. And I recommend finding leaders slowly instead of quickly, and by who shows up. And that's really much how we pick who leads each project. And And then as far as like building partnerships with coalition, yeah, I think with the Fair and Coalition, it's beyond patients, kind of like Kim was saying. It's, you know, it has to be patients, hospitals, industry, payers. We, you know, our last 2 payer forums, we've had 6 payers, insurance companies attend, which has been really exciting, researchers. And we just really feel that all parties need to be at the table in policy. And and a lot of these projects, what that does is it creates projects and opportunities to collaborate. And then you when you're talking about policy and things, you really do need that patient and evidence together, and which is why it's so important to bring all these different groups and involve them. So again, we just need every opportunity to partner, and I think whether it's big or small, any opportunity is an important one. That's what I feel like I try to, and showing up to everything. Like we show up to ER rooms, we show up to our colleagues' fundraising events. You know, you just show up, and you. I don't think I've said no to anything Every Life Foundation has told me, so don't take that to the heart. But yeah, but you know, it's just showing up, and you just make it work. And I'm not saying like overcommit to, and not, you know, you have to have boundaries, but I pretty much try to not say no, or where I can meet someone halfway, you know, with my time. So I'm involved in a lot of organizations. I don't even know how many, but and what's beautiful is that we do almost every project with at least 1 or 2 collaborators. So a quick example of that is, you know, with our payers, we're working on 3 projects with them. We're working on prospective and retrospective surveys, you know, for a family unit. We're working on payer guidelines. And everybody just steps up, and we're all, you know, it's not like we have to take on this load ourselves. And we work with genetic counselors at our university, and, you know, we teach them about policies that are important to them, and we bring in patient stories, and then we get capstone projects out of that. And now we build a toolkit with Illumina, and from that, you know, and with industry, you know, we work, you know, on RUSP, we work on these surveys. 2 industry partners are working on these, funding one of these big projects, cell and gene therapy education. There's just so much more to collaborate with than just, you know, sponsorship or that. There's so many projects that we can really elevate each other with. And we're working with companies like TF Analytics on complex care coordination pilot program. And anyways, it's just, I guess what I'm trying to say is that there's opportunities for collaboration in ways that you might not think with all these stakeholders. And the more of a collaborator that you can be, I 100% believe that more successful you will be. So the better collaborator you can be, the more success you'll have. So yeah, if you're interested in bringing something like the fair to your state, happy to talk about that. We try to we get funding from a separate organization. It's all under a separate organization, and we try to bring money to each state so that they can work on projects too. So we help with that as well. But yeah, I think through this fair and this, and I'll say that the coalition has served kind of like in par with the RDAC. So I think that's an important thing too. It's, you know, like we need that legislative voice, but I feel like the coalition is kind of the people that do the push, because oftentimes these RDACs live under Department of Health or the universities. And so this coalition serve as, you know, and so it's harder to get some of those things done, but you need that voice. And so the coalitions are a really good opportunity to like push for some of this legislation. And then I guess I'll mention what some of our things that we're working on: newborn screening, whole genome sequencing, RDAC, accelerated access to Genetic Counseling Service Act, PRV, NIH, Medicaid. Those are just some of the things that we either are trying to pass or support. Give a Kids a Chance Act. And I'll say that with the policy stuff, I'll say that it's a lot of times there are different, when you have these collaborations and these coalitions, A lot of this policy stuff can also be done. We kind of do it through 2 vehicles. We'll do it, you know, legislative route and non-legislative route. So like with like the newborn screening, you know, we were doing the legislative route and we were just talking to our Department of Health and State Board of Health. And now we're adding 5 diseases this year to our newborn screening. And it was all done through just that relationship. And we've been able to decrease that time it takes to add a new disease to the newborn screening just by our collaboration with these departments and you know, and building that credibility, because we have all these connections with Marybridge, Settle Children's, UW. And so anyways, it's just there. And so it's still, you can go both ways and you can make things go faster sometimes. And if you're going, you know, at the 2 different angles. And so we do that with whole genome sequencing as well. So we got inpatient and outpatient with whole genome sequencing, like outside of, you know, not through the lobbying route. And then now with the lobbying, we can work on making sure there's reimbursement, because that wasn't happening. And so, you know what I mean? So that you can really just work them together from both angles. So that would be the other thing that I would add. But I don't know if I'm over time, but I try to be quick. I'm sorry.
No, thank you so much, Carolina. We're gonna take any questions for Carolina at the end. Yeah, thank you again. We worked very closely with Northwest Rare on a variety of things, and we were actually at the Northwest Rare Disease Fair in Seattle earlier this year. So do look out for more information on rare disease fairs popping up all over the country, because Carolina is excited to help facilitate some of that. For now, though, we are going to shift over to my little portion. I've got just a couple slides for y'all, sort of putting together some of the things that we learned. So you heard from Stephanie about how the coalition that Hemophilia Association of New Jersey has built around the copious accumulators legislation worked towards getting that bill moved along. We were actually very excited to partner with them for New Jersey State Advocacy Day earlier this year. And that was something that we wouldn't be able to do if there wasn't such a excellent coalition and organization built around this issue and around and the bill. And Hanjay really took off and owned it and did a fantastic job there. It's a great example of how coalitions can mobilize around legislative targets. You heard from Kimberly about how you can build a coalition out of not just your advocates, but also from other institutions, researchers, industry. You can have your own way your coalition interfaces with legislators. And then Kimberly's excellent project expanding the way coalitions work together across the country with the network. And then you heard from Carolina about the different ways that coalitions were set up and how the needs that we learned about from the Rare Disease Fair can help inform the work and the people involved in the coalition in the Northwest. There's so many different ways you can sort of bring people together around rare disease issues and channel that energy into very productive action for advocacy. And so that's what I'm going to be talking about today, is how RDLA actually works with rare disease coalitions. So I'll start right now with state rare organizations. These are disease agnostic rare organizations that fight for rare disease issues in the state that they operate in. Northwest Rare is in our book an example of a state and regional rare disease organization. And then Wisconsin Rare Disease Alliance as well is one of those. We are a national organization here at Every Life, and we don't always have boots on the ground in every single state. So we rely heavily on organizations in the state to keep us up to date about what's going on in the state, the rare disease issues in the state, legislative activities, and connect us with advocates, find us stories, all the things that we were talking about throughout this webinar. These are things that when we want to engage with them, we work with state organizations and local organizations to do that. So on the screen, you'll see a couple of examples of the state organizations we work with. It's not the whole list, but as you can see, Wisconsin Rare is there, the Northwest Rare Disease Coalition is there. We also have examples like California Rare, Ohio Rare, Oklahoma Rare. I know Sky is in the chat and is in the attendance. Oklahoma Rare is another organization that we work with. We don't have organizations in every state, but when there is a state organization, this is kind of our main point of contact in the state when it comes to connecting to advocates, finding stories, and whatnot. There are many ways we work with state organizations. One of the things that we like to do is regularly convene state organization leaders. So if there is a state organization, the people leading that org, we multiple times a year and then once a year in person, we'll bring them together to exchange notes and stay up to date with each other on what's been going on in their state, trade notes on what's been working, what hasn't, and bounce ideas and prepare for the next year. We can help put together action alerts, add items to our newsletter, and then help mobilize advocates directly in the state when an opportunity arises for a advocacy action in that state. So if a state organization reaches out to me and says, hey, can you include, say, our state advocacy day in the newsletter, I'm more than happy to do that. And that's one of the ways that we help just assist with their work. And then rare disease state advocacy events. Some of you have in the audience have already participated in some of these, but multiple times a year we work with an organization in the state to put together an advocacy event. If there is a disease agnostic rare disease organization there, we will have a major partnership with them, or we'll try to have a major partnership with them to put the event together. And then through us working and then them working together to get as many people to the event as possible, we host the event. A couple years ago, we worked with Ohio Rare, and then soon we'll be working on another state advocacy day with the state organization, and just look out for that announcement in your email. There are also other ways that state organizations will help every life. So one of the things that we rely on them a lot is just up-to-date legislative information and insight on what's going on in the state. They can often connect RDLA to legislators, policymakers, other advocates, and other organizations in the state and help expand our network. And then state organization leaders, as Carolina mentioned, are frequent collaborators for a lot of our programming. They are often a big part of how we educate advocates, especially if it's something that's happening in their state about rare disease issues. Most states don't have an organization, but coalitions are bigger than just the state organization, and they often exist without a state organization present. In that case, Every Life will work with a prominent disease-specific coalitions and individual advocates in disease-specific organizations. And a great example of that is Hemophilia Association of New Jersey. There is not a New Jersey rare, but Hemophilia Association of New Jersey was leading on a key rare disease issue with the copay accumulator spill. And so when we came to New Jersey to do the event, and we thought that would be the state that we want to work on, we went to Hanjay for a collaboration there, because there is not a New Jersey rare, but there still are rare disease advocates, and there's still passionate, capable organizations that are engaged in some really important fights. And so, yes, if you're not part of if you're not a disease agnostic organization, we'll work with someone that's not categorically that. So that'll include rare disease specific organizations. It can sometimes include state chapters of national organizations, or just individual advocates that are really active in their state. They don't have an organization behind them, but say they're a rare disease parent who decide, you know what, in my free time, I'm going to dedicate my energy to helping out others and fighting on behalf of rare disease patients. So we look for folks like this to work with and to build communities with in these states, because even if there is not a state org, there can be a Hemophilia Association of New Jersey or something like that in the state that can be an incredible partner for your rare disease advocacy. Coalition building, my personal key message around coalition building, if there was one thing to take away from my part of this presentation, is that coalition building requires finding common ground with potential partners to collaborate on advocacy activities and communicate the patient voice to policymakers. There were so many collaborations that Every Life engages in quite often. Some examples are right here. As I mentioned, New Jersey Rare Disease State Advocacy Day. We worked with one of our panelists, Stephanie Lapido, to educate our patient advocates in New Jersey. We had 28 patients hold 19 meetings and help express the patient voice to legislators. Earlier in the year, in January, we worked with the Lymphoma and Leukemia Society and the National Psoriasis Foundation to put together Virginia State Advocacy Day. Virginia does not have a rare organization, and there isn't quite an organization like Hemophilia Association of New Jersey for Virginia, but these two national groups were very active in the state at the time, working on RUSP alignment legislation and prior authorization legislation. So we collaborated with them to put that event together. And so the key thing is you got to find potential partners where the common ground is, and then do the work that you got to do, build community around it. And I really like what Carolina said about figuring out what the needs are and then building community around that, because that really is how that's kind of the heart and soul of the coalitions, is you find the people that really want to work together on solving this problem. Another way that we do coalition-related activity is our Community Congress. Our Community Congress is a membership-based program, and it's dedicated towards bringing a variety of rare disease stakeholders together to sort of act as a strategic advisory council for us. They help inform us on a variety of rare disease issue matters. They can help inform some of our positions on policy, and we refer to them a lot on to keep them updated and let them know that what we're doing. And this too is meant to sort of operate as a network where folks that are part of Community Congress can come together and exchange information. We have 4 working groups in Community Congress: the Newborn Screening and Diagnostics Working Group, Access and Value, Public Policy, and Regulatory. And Community Congress has been around for a little bit. It has been instrumental in putting together a variety of our programming, but there are 2 key pieces of research I want to highlight. Our National Economic Burden of Rare Disease Study, which is a very important national data point on the cost of rare disease. That was something that Community Congress helped inform. And then our study on the cost of delayed diagnosis. That as well was something that we consulted with Community Congress on. This is an excellent program that is very robust. I think it really is one of the jewels in the crown when it comes to Every Life, and we're very proud of it. So that is my main presentation. I'm going to shift over to a Q&A. Now we have 7 minutes, but we don't have too many questions. So here's how we're going to do it. The very first question that was in the chat for us was a question for Stephanie. And let me just make sure I have it right in front of me. Yes. So the copay accumulators bill, is that in New Jersey, is that legislation that only impacts state regulated plans, not ERISA governed plans? Can you speak to that?
That is correct. It is a state plan based legislation. The National Hemophilia, or excuse me, the National Bleeding Disorders Foundation, they recently changed their name, and I'll still never get it right. But they are working on the federal end of things. So, we know that federal trumps state, and right now there is no federal legislation. So, the ERISA plans kind of take over, but we figured we would get started as soon as we can on the state level.
Excellent. And then our copay accumulators and maximizers, are they more commonly with self-funded plans or employer-sponsored plans, or both?
I've seen both.
You've seen both?
Yeah. Yep.
Okay. To know. Okay, I just want to make sure I did not miss any other questions. Kimberly, Carolina, Stephanie, would you mind putting down your contact information if you're willing to in the chat? I want to remind folks that if you're from Wisconsin, there is a Rare Disease Advocacy Day coming up in Wisconsin that Wisconsin Rare is putting together. Please reach out to Kimberly for more information about that. And then please look out for rare disease fairs in the next year popping up, maybe close to where you live, because Carolina's been working on that as well. And that, again, is something that it's a big coalition, effort from Northwest Rare and their partners to really, spread the fantastic event that they put together across the country. All right, that should be it. I will leave you all with about one more slide. Just want to make sure I hit it. For our final announcement, which is the 14th annual Rare Voice nominations are live. If there is someone who in your life or that you know that is a rare disease advocate and you believe that they should be recognized for it, please look into the Rare Voice Awards. The nomination form is at this link at everylifefoundation.org/rarevoice-awards. Nominations close on August 22nd. Please nominate the rare advocates that you know. And we'll see you at the end of the year at the award show. Thank you so much for being here. I will have this webinar on YouTube within the next day for folks that want to watch this again. And yeah, thank you so much for being here. Thanks, everybody. Bye.